a similar condition and asks whether it puts him at an increased risk of malignancy. What is the increased risk? No increased risk. 1 headaches visual field defect. 1 headaches visual field defect growth hormone secreting pituitary adenomyoplane radiography. Heel pad thickness 25 mm. 2 foot pain on walking well-defined cystic lesion in the second metatarsal head plane film 6 months later show sclerosis and flattening of the second metatarsal head. 3 medial knee pain flattening of part of the medial condyle and a radiolucent focus. Spontaneous osteonecrosis of the knee. 4 pain and tingling in the radial 3 and 1/2 digits nocturnal burning and tingling thenar wasting. MRI features. Increased signal intensity of the median nerve on T2WI. 5 Ehlers-Danlos syndrome investigation contraindicated. Aortography. 6 right total knee replacement knee pain stop. Show focus on horizontal uptake in the medial tibial compartment explanation. Weight-bearing load area of knee producing uptake. 7 non-specific bone pain bone scan shows avid diffuse uptake in the right femur corresponding to a thickened cortical outline. Diagnosis. Monostotic Paget's disease. 8 lump on the dorsal aspect of his hand moved with the tendons on flexion and extension of his fingers. Imaging findings expected. Periosteel new bone formation. 9 bruised his right knee. 2 days fever. Knee was extremely tender, swollen, and the movement was restricted. Blurring of the periarticular fat planes is common. 10 hemochromatosis with pain in his hands. Distribution of involvement. Metacarpophalangeal joints of ring and little fingers. 11 rheumatic fever. Polyarthropathy. Metacarpophalangeal joints of both hands able to voluntarily correct the subluxation. Jacob's arthropathy. 12 hitting his thigh. Films calcifications in the tissue adjacent to the femur and some simple periosteel reaction. CT equals peripheral ossification. Diagnosis. Myositis ossificans. 13 ankle deformity. Reduced proprioception of this leg such that it was only minimally tender despite dislocation and marked bone destruction being visible on radiographs. Charcot-Marie tooth. 14 iron deficiency. Anemia. Feature rare occurrence of her anemia. Hair on and appearance of skull. 15 known Paget's disease of her skull following a fall becoming more confused. Feature secondary to Paget's disease. Hydrocephalus. 16 known rheumatoid arthritis. Right shoulder pain. Features would be typical. Tapered margin of distal clavicle. 17 overweight 12-year-old boy limping at school. Stiffness in the right hip. Improved with wrist. Radiograph line drawn along the superior edge of the femoral neck. Klein's line does not intersect the femoral head. Diagnosis. Slipped upper femoral epiphysis, SUFE. 18 with foot pain. Radiographs non-specific. What diagnosis with the presence of periostitis fever? Psoriatic arthritis. 19 foot stiffness. Tarsal coalition. What type? Calcanean navicular. 20 chromosomal disorder. Feature diagnosis of Turner's syndrome over Down syndrome. Madelung's deformity. 21 history of breast cancer. Back pain. Bone scan other than metastatic disease. Cause of increased uptake. Dental disease. 22 high-speed road traffic accident. Aortic injury. Most likely to have been injured just distal to left subclavian artery. 23 being treated for a pelvic fracture and hematuria. Perineal ecchymosis. CT for further assessment of his urinary tract. How long after injection of 100 ml of low osmolar iodinated contrast at 15 µs into the antecubital fossa should images be acquired? 4 minutes. 24 12-year painful, swollen left knee. Radiographs. A bone fragment on the lateral aspect of the knee that was felt to be secondary to popliteus tendon. Avulsion function of the popliteus muscle. It controls lateral meniscal displacement. 25 shallow swimming pool. Struck the bottom of the pool head first. Large scalp hematoma and some upper cervical spine tenderness. CT head and cervical spine. 26 severely bruised and swollen head. What fracture is he most likely? Fracture of the shaft of the 5th metacarpal. 27 55-year-old lady. Rheumatoid arthritis. Sudden onset pain and swelling on the medial side of her left foot. Marked weakness of plantar flexion and inversion on the left. Normal power on the right. Tendon is most likely to have been injured. Tibialis posterior. 28 schoolboy assault. Initially fully conscious but subsequently became comatose after assessment with CT. A neurosurgical intervention produced an excellent recovery. Most likely appearance on the CT. A biconvex collection of high density adjacent to a linear lucency in the skull vault. 29 A high-speed road traffic accident. Hemodynamic shock. Abdomen became tense and distended and there was a profound acidosis on arterial blood gas analysis. Findings on CT are most sensitive for surgically important bowel or mesenteric injury. Intraperitoneal free fluid. 30-40 miles per hour collision stable fracture of his cervical spine. Clavicular fracture. 31 footballer was tackled from behind. He felt a sudden pop and his knee became swollen and unstable. Leg pivoted outward about his knee as he walked. Findings on the MRI. MCL rupture due to valgus stress. 32 history of breast cancer. Technetium 99 bone scan. Diffuse uptake throughout the lumbar vertebrae and ribs. Anatomical sites is most suggestive of metastatic bony disease. Vertebral body. 33 horse rider. Severe pain in her left thigh after riding a horse for the first time in many weeks. Ultrasound scan most likely abnormality. Discontinuity of musculotendinous junction of adductor longus muscle. 34 17-year-old girl attempted suicide jumping from the second floor. Left leg sustained almost all the impact. Left leg was severely bruised with an open wound. Committed a distal tibial fracture with intra-articular involvement associated with a fracture of the midshaft of the left fibula. What type of injury? Pylon fracture. 35 severe blow to the side of his face during an assault. Was unable to open his mouth. Facial radiographs. Facial fracture most clearly seen on the submentovertex view. Zygomatic arch fracture. 36 pain and swelling.
आसान है ठीक है ये जो formation ठीक है कंट्रोल टोटल aspect of the hand moves with tendon and flexion so any finding इसमें फिर structure की exam diagnosis है और इसमें continuous formation expert है ठीक है हेमोक्रोमेटोसिस में जो है recover bringing fingers होते हैं ज़्यादा तो finger जो होना चाहिए ऑप्शन में ठीक है finger and finger ठीक है हेमोक्रोमेटोसिस ये रीड प्रोप्रोसेप्शन leg ये जाकर मैं टूथ में जो है चाकट ड्राइव करते हैं ठीक है चाकट आर्टिकल नोट उठार्टाइटिस टेबल मार्डम क्लैविकुलर होती है एब्सेंट क्लैविकल टेबल मार्डम डिजीज क्लैविकुलर होती है उठार्टाइटिस नंबर ऑफ जॉइंट इन्वॉल्व ठीक है psoriasis होता है तो ये रेगुलर psoriatic arthritis number of joint involved and psoriasis कुछ breast cancer तो फिर जो है other than metastasis further increase uptake है तो ये जनरल डिजीज ठीक है अभी चाहे psoriatic action aortic injury और injured distal left supply artery ठीक है BCS ब्रेक से पहले common cardiac and supply arteries arise होते हैं ना तो just supply artery how long after injection of 100 ml low osmolar ordinary contrast should second in the low life should image be required ये 4 minutes ठीक है तो तैयार तो कि जो bladder full होता है 1 घंटे में लेकिन हम bladder को खोलने के लिए 4 मिनट लगते हैं तो ये 10 मिनट का भी ट्राई करते हैं function of peripheral muscle control lateral muscle displacement अच्छा फिर was in a fight or severe bruise on one hand तो boxer fracture होते हैं boxer fracture मतलब sharp or fifth metatarsal fracture tibialis posterior plantar flexion करते हैं TAP और Ponius longus extension और dorsiflexion करते हैं ना tip या पैर tibialis posterior ठीक है plantar flexion weakness of plantar flexion and reverse of left foot so tibialis posterior inverse and plantar flexion TAP inverse and plantar flexion और Ponius muscle जो होता है ये everse and dorsiflex ED ये अपने ट्राइगोल हेमाटोमा का सिनेरियो है फिर रोटर एक्स में जो है सिग्निफिकेंट फाइंडिंग जो है इंट्रापर्सनल फ्लूइडिटी ये ब्लड जो है Tail fracture of cervical spine play a role in fracture. Knee becomes swollen and unstable and pyramid outwards. तो ये है MCL operated to valgus stress. A factor of F for fibula तो FP की तरह से final factor होता है इसमें ठीक है communal tibial fracture with shaft of fiber fracture